Okay, guys, we are finally back with episode 3 of What Had Happened with Dr. Allison Hicks. Aaron, are you a doctor?
Not a doctor.
Okay, Aaron Bernard.
Hey, wrong.
I said the last name right?
Yeah.
Okay. I am your host, Monique Slaughter, and this is my co-host,
Tiffany Campbell.
And today we have a really special mukbang. This is a mental health madness mukbang. So, let's get right into it. We are going to talk about mental health or mental illness versus emotional disorders. So, is there a difference between the two labels? Because when you hear the term mentally ill, you think, standing on the corner shucking and jiving with your trumpet.
Schizophrenia, stuff like that. And so we don't use the multi-axial system anymore. So what that is when you diagnose someone, there was like axis 1 disorders, axis 2, axis 3, axis 4, and axis 5. And we've kind of done away with that. And so when I hear emotional disorder, I think people are more so referring to axis 2 disorders, which are personality disorders. So those are disorders.
Narcissism is a personality disorder.
Narcissism,
right?
borderline personality, dependent, obsessive compulsive personality disorder. There's an axis 1 OCD, obsessive compulsive disorder, and an axis 2 obsessive compulsive personality disorder. And so I think people are often talking about that. And so the primary difference is that all the axis 1 disorders are things that can definitely be medicated. There's a number of treatments for them. Personality disorders are a little bit different to treat because they're what we call characterological. So that basically means that it's about your patterned responses.
Okay.
And there's not always medications that can cure narcissism, right? There's no medication for it.
No?
You can work with people who maybe have you can work with symptoms of it.
Okay.
Like irritability or aggression, but you have medication for depression.
Right.
Right? Directly for depression. And so it's the characterological difference. It has a lot of emotional stuff that goes along with it, right? It's hard to regulate your emotions sometimes. Things like that. So that's what I think of when I think of the difference between emotional and mental health. Or mental illness, rather. That's what, yeah.
And what came up for me just now is that I feel like there's a stigma with mental health, when people say the word mental health. And really, just like you go to the doctor for blood pressure or just you have a cold or a flu or something like that, I feel like it's really important that people we normalize mental health and talking about it and mental illness and get into the fact that there are emotional disorders and that someone in everyone's family is dealing with some form of mental health. I mean, mental illness, I believe, is somebody in your family, and we all deal with mental health.
Yeah.
And basically with mental health, it's just a matter of can you function emotionally and or behaviorally.
Because you bring it up, because a lot of people, I teach classes, and so when students hear about a lot of disorders, they're like, oh my God, I have that, I have all of it.
Mm-hmm.
And what I always tell them is, we're looking, when we diagnose people, when people diagnose people, I don't diagnose, we're looking at things like the duration, how long have you had this, and how severe it is. Is it so severe that you can't go to work anymore, that you're not able to care for your children, that you're not able to function in the world the way that you used to function.
Right.
And those are things that we're really looking for. So functionality, severity, and duration. And so those are some things. So I'm so you came to class today, so that doesn't mean you don't have a mental illness. That means you're functioning pretty well today.
Right.
So congratulate yourselves for functioning well.
Pat yourself on the back.
Can you guys explain to the people what the different types of mental health professionals there are and what they do? So there's
so many.
Yeah, there's but the general that we hear of on a day-to-day basis, people say oh, I'm going to therapy. But there's psychotherapists, there's psychologists, there's psychiatrists, there are family and marriage and family therapists,
So,
there's behavioral therapists, there are
Yeah. See, because a lot of that, so there's your title and then there's your specialty.
okay.
Right? So you have from the top,
They're like the creme de la creme of our
psychiatry. All my psychiatrist friends are like, Allison! But yeah, so psychiatrists are medical doctors, so they have an MD. They go to medical school and they get training in psychiatry on the way, and mental health and things like that. And they're the ones who give you medication. Right? So then after that, we have psychologists, which are people who have a doctorate in either psychology or the philosophy of psychology. So PhDs are doctorates in the philosophy, and PsyDs are doctorates in psychology. And they do not prescribe in most states. Some states do allow PhDs and PsyDs to
Yep.
prescribe. California is not one
Not
of those
here.
states.
Right, because I have to see two.
You have to see two. In some states, psychologists, PhDs and PsyDs can prescribe.
Mhm.
That is not the case in California. I cannot
Nope.
tell you the list of states
I
that
have
allow
two.
it.
I have two.
Yeah, so you have two that you see.
I-
You see an MD, and then
For
like you see
meds.
like a doctor for
You have
your
psychiatrist
for
for
meds.
medication.
Yeah.
Mhm.
And my therapist is technically a psychotherapist.
So
Which
Well-
scared me.
this is
Well, psychotherapist
this
has
is
an
different.
umbrella.
So
There's
this
an
is
Okay.
umbrella.
different. So you have the degrees, right? So you have MD, PhD, PsyD, and then you
And
have
MSs.
EDD. You can also get a doctorate in education of psychology
Mhm.
and still get licensed. So you do see some people that have a doctorate in education.
Yes.
Some people do have doctorates in education of psychology, and then we get to the master's degrees. And Erin, go in.
Well, so after Allison's awesome career, because she's the psychologist, there are people like me.
PhD in psychology.
PhD in psychology. I have a master's degree in marriage and family therapy, which means I no longer, but at the time when I got my degree, I was doing psychotherapy as well. So I treated depression, anxiety, OCD, oppositional defiance disorder, like grief, couples counseling, things like that. And there are also other people that have master's degrees that could also treat and do psychotherapy, like LCSWs, like licensed clinical social workers. And so like there's several different people that can treat, and honestly, we all work together. Sometimes, people think like, oh, we're not the same. We work differently, but we can work together. So like I, in my field as a marriage and family therapist, used to work very collaboratively with the psychiatrist. So my client would have, they would take meds.
Right.
And so and we would consult with each other to make sure that we were making a nice team for the client, to make sure that they had the best support possible.
Right.
I talk a lot about teams. So then we have words like psychotherapist, right? So that reflects the orientation that you have toward therapy, right? So I can have a PhD and I can be a CBT therapist,
Yes.
which is cognitive behavioral therapy. And so the way that I treat people is through cognitive behavioral therapy. I can also be a dialectical behavioral therapist.
My therapist
or-
gave me a dialectical behavioral therapy book.
Dialectical behavioral therapy is my favorite modality.
Okay, well,
I love it.
I didn't read past the first couple pages because I felt like when I saw the word dialectical,
It was a triggering word?
It triggered me. It feels very much like diabolical.
Well, what it is,
And I
not.
don't-
It's such a bad word. You're right. It does sound like diabolical.
It sounds like the word diabolical. So
It
I
does.
never wanted to read it because I'm like, I'm not Jeffrey Dahmer or
No.
Charles Manson.
So
like,
the dialectic, why I like it is holding two very different thoughts in your mind at the same time. I can be wonderful and still need to change,
The word die too.
right? So
duality.
you can, it's a duality. So you can still be, you can love your body the way it is and acknowledge that you need to be healthier.
Mm-hmm.
Right? They're two opposite things. So you don't have to reject
so in other
one.
words, I look amazing.
Amazing.
But I should probably not fill my lungs
Right?
with
Right.
carcinogenic.
That's it. And so you can hold these two
Amen.
things.
Amen.
And for a
Amen.
lot of people, it is hard to hold two very different thoughts about themselves. Like I have done something bad to someone,
Mm-hmm.
right? I have
Doesn't
stolen,
make you evil.
harm, but it doesn't make me
It
evil.
doesn't define who you are.
Right? You can.
I
hold
can be
both.
broken and not be bad.
I can be broken
Yes.
and not be bad. So that is the kind of at the center of dialectical behavioral therapy, where what your job is you're pulling your patient to the other side,
Mm-hmm.
so that they can create balance.
A more balanced
You
perspective.
can create, so you're bringing up new ideas and you're teaching them skills so that they can begin to work with the world. And so that's a modality. And so psychotherapists sometimes are analytical. They have a psychodynamic background,
Mhm.
and that's like what Freud did. And so it's just
And there are Freudian dreams.
there are Freudian dreams. There's
My
Jungian
baby
dreams.
daddy had a dream that he was playing basketball, choked me in his sleep,
Should bring it up.
and did me like this. And when I told my dad the next day, and my dad confronted him, and he said he'd had a dream about basketball. So Freudian dream. So it's something that
So-
feels very real, right?
Wow.
Yeah, well, Freud interpreted dreams very.
Now that I think about it, he was trying to kill me.
Well, here's the thing. In dream interpretation,
He tried to kill
dream
me.
interpretation, you cannot interpret one dream. You have to get a lot of dreams
Yes.
and begin to identify
The
patterns.
Okay, so Aaron, I see Aaron over
Trying
trying
to
to save my baby daddy
Trying to
from
make one dream a thing.
murderous
He
accusation.
could have frustrated him
And you
With
know
some of
what?
the
In all
things y'all were
honesty,
going through, you don't know.
And subconsciously,
You don't know.
he had
You
this
don't
dream
know.
about basketball, and
You
I just
don't
so
know.
happened to be in the bed, and my head was the ball that he was.
and that actually
wrestling
happens a
for.
lot. That happens a lot. I mean, this is going off topic, but it
Okay,
depends.
well,
It
let's
goes
stay
off,
on
but
topic.
there are a lot of couples that deal with that. Like if somebody went to war, there's trauma
PTSD.
and PTSD. There are definitely.
He
I
must have been
clients-
traumatized from that time where I didn't have sex with him for 6 months, and then he
Okay.
dumped me and all my things on my parents'
Just
front
everyone,
lawn.
please notice my mouth is not saying these things.
Mine
I'm
isn't
saying
either.
it. He was frustrated, and
My
he had
mouth-
this Freudian dream, and he.
And this is one perspective, one option, but
You
once
won't
again,
sleep with
Allison
him.
just said you got to look at the series of dreams.
Oh,
and
I
there got to be a
can't. I didn't
pattern.
see
It's
his
one.
dreams.
It's one.
So what they'll have you
dream.
do is they'll have you do a dream journal.
Boom.
Write down, and Jungian therapists do it as well.
Mhm.
Jung had a perspective. He talked about the animus of the cave and all this stuff, and he did a lot of dream interpretation as well as Freud, as well as Karen Horney. Like a number of different researchers did it, and so psychotherapist is like the type of therapy they provide.
Mhm.
So they could have a PhD or a PsyD or a master's, but it's in the orientation of therapy that they've learned.
Got it. So,
So
in the
I
state
just-
of California,
Mm-hmm.
PhDs and PsyDs cannot prescribe meds.
No.
MDs can.
MDs.
That would be a psychiatrist.
Psychiatrist.
Even your family
Medical
practitioner,
doctors.
your medical,
Your
any
medical
Your
medical doctor,
general practitioner,
they can
right?
give you psych meds too.
Correct,
I
because when-
recommend a psychiatrist, but
Because when my psychiatrist was out for the holidays, I was out of medication for 2 weeks, and he said you can go see your general physician,
Yes. Yes.
and he can refill the prescription for a week though.
But
He
you
was like,
need to
I
go
want
to a
to see you.
psychiatrist.
Right? He was like, I want to see you when I get back.
Yes.
But your general physician can prescribe. I'll be back in a week. Have him prescribe the meds for 1 week, but I need to actually evaluate you because of what I do for a living, and I travel, and I was filming, and I was this, and I was that. He would prescribe me like 3 months,
Right.
and then I would have to go in when I would run out, and then he would prescribe me 5 months, and then I would have to go in when I would run out.
because normally
Just
they
like
want to
it-
see you every 3 months.
Just like here's the thing: when you go to a doctor for your physical symptoms, we go to different doctors that specialize in different things. So when you were pregnant, you both pregnant, right? And had kids. So it's like you went to who? What kind of doctor?
An OBGYN
Well,
who
because
worked
they-
closely with
Because
my
they specialize in
psychologist
they,
at the time.
They specialize in that area of the women
Medicine.
anatomy, right? So I think when it comes to like mental health, you want to just go. I think it would be better for if you're dealing with like possible depression, anxiety, postpartum depression. It would be my strong recommendation that you see a psychiatrist because they specialize in the mind.
Right.
They went to medical school just like your OGBYN, but this time they went to medical school.
OBGYN.
Sorry,
That's why you don't never need.
That's
to
why
deliver
my
a baby.
dyslexia is working
He
today.
never needs
But
one,
what I
it's
don't need
good.
one of those. But here's what I'm saying: like they specialize in the mind versus that other part.
Well, I'm glad that you mentioned postpartum. Moving into the next portion of this, we're going to talk about postpartum, and we are now joined by my mother,
Woo!
who loves to talk.
Dive into this.
Just to make it clear, Aaron, you don't have kids.
Don't have
Allison,
kids.
you don't have kids. Marla has.
I don't
three.
have kids.
Marla has 3. I am one of the 3, the oldest, and Tiffany has 2.
This is my daughter. I did adopt
1,
her.
2, 3.
Right. So,
Sorry.
what tends to trigger postpartum? Is it hormonal? Is it environmental? Do women feel postpartum during pregnancy, or is it all relative? Is it like different? You know.
Everybody experiences it a little differently, and
Yes.
every researcher has a different perspective on it. But it's like a combination genetic predisposition. So you can have depression in your family, which might make it more likely for you to become depressed or anxious, because there's also postpartum anxiety. It might make you more anxious during that period because you do have a lot of hormonal changes, obviously, right? More progesterone, estrogen, everything is changed and everything is different. And then there can be environmental things as well. You know, if you're having conflict with your partner, if you're having conflict with your family, financial things that are happening. So a lot of things can kind of all come together to create the
A
phenomenon
fraction,
of,
if you will.
yeah.
Is one of
Yeah.
the triggers that we're all gonna sit here and act like everybody has food but me? Is that
I
what
was,
it-
I was just gonna ask you.
is this? Is this?
Oh, you gotta
is this
dive in.
Oh, my plate has a sticker.
Oh, she said-
This bulb is not
That
supposed
bowl
to
The
doesn't
bowl
have
is
a
good
sticker.
though.
Would you like oatmeal?
is that we just gonna act like I
Potatoes?
don't need to eat?
Oatmeal and potatoes?
We just started diving in though.
No, we just
Some fruit
we,
for you?
we were psychic. We thought.
Okay, so I know Marla had postpartum. She hid in the closet from me, and she wouldn't
Did.
let me suckle from her teeth.
I know that's not okay. Can I?
Then she punched me in the ear.
Correct the story.
Then she punched me in the ear when I was a teenager.
That happened. But it
Postpartum.
was
Postpartum.
That's postpartum.
I don't know
15 years
if
later,
that's- I don't know
16
if
years
that's-
later,
I
she
know
was
that's postpartum.
post-delivery. 15 years.
well, yeah.
Later.
Okay, so because I still don't know if I had postpartum.
Okay.
So I think. Go ahead. Talk.
Like, what made you say like, okay, this is postpartum?
Okay, so for me, when I had Moniece,
Okay.
number one, I was very young. So I delivered Moniece a couple of weeks after my 19th birthday.
Okay.
So just for me, the stress, I understood the gravity of bringing
Becoming a parent.
Yeah, and understanding that, wow, even though I didn't have all the answers, not even hardly, I felt the pressure of needing to make a way to be able to be what I needed to be for this little girl, baby. So with that in mind, I was overwhelmed. And when I came home from the hospital, first of all, Moniece was 8 pounds and 6 ounces. So let's not act like the
Very
therapist
big baby.
baby.
It's a big
Okay?
baby.
It's a big baby.
And she was very demanding.
Okay, I can understand that. I can understand that. I get that. I get
So
that. Your
you
character
see?
is formed by the time you're
You
5.
see how
Right,
this
right,
turned
it was
around?
there. Right.
Family and friends came together, and this was another trauma for me.
So anyway, so the bottom line is,
Shame.
I started feeling like, at the time I was with Moniece's father, her biological
My
father.
sperm donor, yes.
Okay, we're not gonna
She
shade
won't call him
anybody.
that. I'm not shading. That's what it was.
Anyway,
Continue.
I got a sperm donor.
we were together, so I have to say that
Baby
it wasn't
sperm
like
donor?
I was out. What's happening here?
A lot is happening.
There's a lot of
Okay, I'm
triggers- a lot
sorry.
of
So
triggers
just
there.
quite
answer the
overwhelmed.
question. When did you think you had postpartum?
I didn't think I knew for sure
Okay,
because I
when?
wanted to be. It was about 2 weeks
After I was born.
Yes, and at that point,
Were you depressed during the pregnancy?
no. I wasn't depressed during the pregnancy.
Oh.
But after the pregnancy and when I delivered you and I came home, I just remember not wanting to be I couldn't navigate. I was like, I can't, my mom said,
So
okay,
when did you
let's get
start
her a
hiding in the
bath.
closet?
That was about at the 3rd week. I was like,
Oh,
okay.
wow.
I actually did hide in the closet.
No, what
Wow.
I've gone in my
Can you get
closet
that
a
off
couple
her?
times. Was what
Our eyelash.
was that? Was it like
We're gonna take this one
just
5 more.
overwhelmed, like where you just had to catch your breath? Because that's me. Like I'll just be like,
No, it was detachment for me. I was overwhelmed, but I also was detached. I didn't want to. I did what I had to do, but I really was like, I can't do this. I felt like I can't do this. I can't. And I
But did you
remember,
want to?
But I will say,
I had a desire to love you, but at that moment, I couldn't. It's like being stuck. And so I see that I need to do these things, but I was looking at the gravity, this huge situation that I knew was forever.
yeah, I want
So
to
what if-
normalize that a little bit. I
Yes.
think a lot of women feel that way, even women who don't have postpartum and women who do both, because it
That's
is
right.
an enormous decision you've made, right?
Those
Because
are
it is
cold.
it is forever, and it is this beautiful little child that now entirely depends on you, can do literally nothing, and so a lot of women do naturally feel a little overwhelmed, like, oh my god, especially if you're young and if you don't
Damn,
have a lot of
need
people
me
connected
eat,
to you.
You need me to wipe you.
Like,
you
you're
need me to
responsible for
bathe
this
you.
being
You need
for
me
the
to put your
entire-
clothes
their
on.
And I'm a
Right.
big believer in villages, right? Evolutionarily, humans
Yes.
have always had villages and tribes and people who help them. And now we live in these very disjointed individual families, so you don't have the support. And so it is much more overwhelming when you're sitting there with this baby and it's just you and them. And it's just like, what in the hell is about to happen, And so I think having that team, you have to have a team.
For
And
sure.
I had my mom, by the way, shout out to Marlene, was my lifesaver. So I moved in
Oh yeah,
with my mom.
Leanie.
Mhm.
And I was with Moniece's father, Michael, at the time. And so I wasn't by myself. So I don't want to
that's good,
misrepresent.
That's good.
Right.
But still, overwhelming.
But you still
So
felt
for
something.
you, so for Tiff, let's give Tiff a chance to speak here. So for you, what makes you feel like you have postpartum?
I just cry all the time.
Mhm.
She's 6 months now. I have a 12-year-old. I have her. I've been doing it by myself since 12. My son, born. So I just cry. And it'll just be throughout the day. Like the other day I was driving back from the grocery store and she's a good baby. She doesn't fuss unless she just wants something. Like she's a really good baby. She's in the back seat and I'm just driving and I start crying. And I'm like, why am I crying? Like, I always ask myself, why am I crying? I cry at least once a day.
Well, it's it,
Really? Because what I know about Tiff is, I'll talk to Tiff, but Tiff, her outward appearance, and I guess as someone who struggles with situational depression, I should know that you don't know really what depression looks like. Not everyone is gonna wear it like me, where I'm like,
Can I just say that?
Tiff is like dressed, and Tiff
This
is
is
like,
the thing,
oh,
though,
I'm
because I
football
have to.
practice, and
I have to. If I don't do it, who's gonna do it? Don't get me wrong. Like, I'm not gonna sit here and sugarcoat shit. If somebody came and grabbed both my kids and was just like, let it out, I'm gonna fucking break. Like, I'm gonna go in my closet, lay down because it's all dark, and I'm gonna break. Like, that's just a break. Like, I'm gonna cry. I'm just gonna be like, I can't have my son looking at, Mom, why are you crying? Mom, what's wrong? Mom, what's wrong? I can't. I don't
I
want
think it's important that I think going back to what Allison said, I think it's important to have a team, and the teams for me would look like maybe a doctor, a therapist, friends, family, like making a list of people that you can go to and tap into, because I think it is stressful to do it all alone.
Oh, yeah.
And no one is an island, you know what I mean? So I think it's
And
important.
then dealing with like a fuckboy for a baby daddy at the same time.
And you know what?
It's just
Or
like,
dealing with
an extra
or
stressor.
or dealing with the bills, or the fact that you have to be
All
responsible
of
for
it.
two different people in two different spaces in their life.
Right.
A 12-year-old and a baby. Those are
Right.
two different, and I think it could be overwhelming. I would say like consulting with a therapist, a medical doctor, creating that team that Allison talked about, I think would be helpful. And then going back to
So
what
does
you
that sound like postpartum?
That's one symptom. That's just one symptom. We can't diagnose here.
We don't diagnose because we're doing
But
coaching now.
I can
but
go
we're
through the
experts.
symptoms if you want. But go ahead.
I was just gonna say that I will speak to that from experience,
Mhm.
and I would say yes. In any mental health scenario that I've experienced, there's still a spectrum. So
Yes.
so what
I would say
will
she's
say
on the
is,
lower and milder end of the spectrum for sure, but I'm definitely no.
You're
I'm
not diagnosed.
I'm an afflicted.
for I will say this, without a shadow of a doubt, one thing that was super helpful to me was to not deny it. So when you try to
Love that.
fight it,
Mm-hmm.
you I believe you're stuck a lot longer. So the one thing that was saving grace for me was for me to be able to say, it's a feeling of being absolutely overwhelmed.
Acceptance is a big thing.
Huge. And once you accept, then maybe you can like talk to whoever your support system is. So I think a lot of times there are a lot of moms from my experience at work that feel like they're by themselves. They can't talk to anybody. There's like an enormous amount of guilt and shame around not being maybe good enough as a mom or a parent or like whatever, like stepping to the rising to the occasion.
That's it. And like the symptoms we're looking for, this changes in sleep. So sleeping more, sleeping less. Changes in appetite, eating more, eating less, thoughts of guilt, thoughts of suicide, preoccupation with suicide or ending it all, nihilism, lack of activity and things that you used to enjoy doing.
And harm to the baby.
That's definitely on the higher side.
But it happens.
Sometimes
Harms
it-
or thoughts about harming your child, even a lack of engagement or connection to your child.
See, even when I'm
So
depressed,
you know what, I'm sorry.
just
That's
in
what
general,
happened. That was that punch to the face when you were 16. That was a
Right,
suppressed postpartum
Yeah,
situation.
that's what I said.
I don't know about
I
that.
was
I
holding that
know
in
for me,
16
I found it
years.
very interesting
I have no research on
that
them.
even when I get depressed now,
Sorry.
I couldn't imagine like hurting Cameron.
Yeah.
Like those thoughts don't even, I'm not, he actually is the only thing that makes me feel better. And then I kind of feel guilty because I'm like, he knows now because we're just a very candid family. So I don't ever want him to feel emotionally burdened to have to take care of his mom. Like, well, I can't go do this because of my mom. Because he says, like, well, who's going to be with you? You're going to be alone. You're just going to have your body pillow. Want me to FaceTime you? I'm like, no, Cam, like go
live
do,
your life.
go live your little 10-year-old
live your little 10-year-old
life, you know? And I
life.
hate, like, now I'm to the point where I couldn't wait for my week off. Now I'm like, darn it.
Where you at? But yeah, and harm to children is something that's more on the extreme end. Like Andrea Yates, we're familiar with, she drowned her 5 children.
Yes, oh my God.
And there was a lot of compounding factors. A lot of, neglecting the diagnosis, not paying attention to it, it kind of growing. She had children back to back to back to back to back with very little support from anyone.
She should have had an IUD.
And I mean, but I think there was also some religious stuff involved and whatever.
She shouldn't have been a Mormon.
Oh my
No, we're not gonna hate on religion.
No, who is the cult?
Let me eat this.
The people? And they
I have
have
friends
I'm not
who are
talking about
Mormon,
no
they're
cult.
amazing.
I don't know.
Okay, I'm not not bashing anyone's religion.
Okay.
Don't do that.
Is that your censor? Can you?
Okay, let's just move on now.
So can I say one thing?
Yeah,
too?
we're over.
What you said, what stood out to me also about what you said is that like Tiffany, you can't always tell because she
Right.
looks together. But I just feel like it's important to remember like postpartum depression. There's postpartum and then there's postpartum depression. And depression, there are a lot of people that look healthy and happy and they're functioning like we talked about earlier, and they're depressed. And if you look at the face of depression, like there's so many, I forgot all the different people, but like Robin Williams, like no one knew really that he was depressed.
Because if success is attached to it on any level,
Yeah.
then it doesn't exist.
And
We
or you
refuse
see somebody,
to be
or you
depressed
see him
with mom.
smiling, or you see him cracking jokes. There's so many comedians that
Heath
are
Ledger.
depressed.
Most.
Heath Ledger. There's so many people in dark places, men and women that are just dark,
Kate
and no one
Spade.
knows. I have friends that are therapists that are on meds for depression and anxiety, and they're functioning,
Anthony Bourdain.
but they have to make sure they get the help. You know what I mean? And so
Right.
there's no shame in it.
So that takes me to the next portion of this
Mhm.
mukbang, to medicate or not to medicate.
I think it's
the question.
And so how crucial is one's diagnosis to their treatment plan? Oftentimes, if you're not properly diagnosed, you can't be properly treated. And Allison actually helped me be okay, which is what like one of the reasons why I talked about it on TV. She always said, like, well, my therapist always said, your diagnosis don't define you.
facts.
One, two. Allison was like, when you get the flu, you don't walk around and say, I'm the flu. Back up, I'm the flu.
Right? Yeah, you are not the
Back up,
diagnosis.
I'm the cold spore.
Right.
You take your Z-Pack.
That's it.
And
Or
you
you
keep
drink
pushing.
it, or you have
And
a
you keep
dad
Hi,
Yeah,
like
nice to meet you,
pushing.
virus.
yeah, or you have a dad like
Virus,
Dave who
right.
forces you to drink quinine.
Right.
Right.
All the things. So, do people who have postpartum, do they take
Well,
meds?
okay.
So
You
let's just
can.
answer the first
You
one.
can.
Treat the
How
symptoms.
crucial is one's diagnosis to their treatment plan? And let's use postpartum as a
Well, I have to just say this. I think that we forget that we are a biochemical
correct.
machine, and so
I didn't
we're
forget.
so willing to accept that we're vitamin D deficient. I'm going to take my vitamin D supplements. Oh, I need vitamin C.
Iron.
If something's
Whatever that
missing,
thing is.
if something's missing, or to me, this is my guide. I have no shame in my game. If I don't feel well and my desire is to feel better, I'm going to explore any option
every
That's
option.
it. That's it.
to be able to feel better. And sometimes that leads me down the roads of right now.
I'm going to see a witch doctor.
I'll give a true confession.
I'm going to New Orleans.
I'm ready.
Speaking of
True confession.
speaking of postpartum and all that, I literally have been in a terrible space. Went to the doctor last week. They called me and said, you know what? You need to come see a specialist. And I was like, well, is there a problem? They're like, no, we can't talk to you over the phone. So when I showed up on Tuesday, this past week, they were like, yeah, you've got the hormone situation, perimenopause or whatever, and they said are you feeling there's something going on with the signal to your brain? And I said, what? So they put me on hormone, and so to try to balance what was happening. But
Right.
the truth of the matter is, I've been feeling shitty for a while, and I've been getting really bad headaches.
Right. Wow.
And so what I'm saying is, in the last 2 days, I'm feeling a little bit better.
Yes.
And so now but the point that I'm making is, I said, listen, I'm not one of those women, doctor.
Right.
What do you need me to take?
This right here is yoni stuff. Yoni, it makes you feel and smell like so amazing and fresh. Also, vaginal tightness and lubrication. This is like the bomb.com. And you ever want to find a way to help regulate your menstrual cycle? Yoni stuff, yoni oil. I love it. I just simply pop the top and drop 3 drops in my bath water. Or if I'm just chilling, Netflix and chilling that is, I just take my oil and I like to rub it all over my body. Yoni, you outdid yourself this time. This is my ultimate favorite. Thank you.
I just wanna make you feel okay.
I'd rather feel better.
Which is what
Then
I always
reject-
say.
And I
Who
think-
doesn't
but
want
I
to
think-
feel
I think-
better?
I
When
think
people
that
are
the-
like, "Oh, you're faking it." Who would
we
want?
place
No,
value. We
right.
place so many values on things
That's
that
individual.
don't really hold a value, right? A diagnosis isn't. It's not a good thing or a bad thing. It's a thing that exists. We place a label on it, of good or bad, right? We
Right.
all are something. We all have something,
Facts.
whatever that may be. And like you said, my little test just came back and I had low vitamin D. I didn't cry, I wasn't upset because there's no stigma around having low vitamin D.
Boom.
Right.
Go outside, get in the sun, I'm brown skinned, I don't absorb as much sunlight, I need to get a little bit more sun, I need to eat some vitamin D. Whatever, I'm vegan, I don't get it from milk. So it's like, there was no stigma to it, so I can publicly say it, but if it was something else, all of a sudden it's like, oh my, what? Oh my God.
You ditzy,
Da-da-da-da-da.
you ditzy D deficient girl.
Yeah,
Right.
and it's like, and I think the stigma is a big part of why people don't want to take antipsychotic medication.
Well, and they also
And-
don't want to
mood
go
stabilizer.
seek treatment to begin
But
with.
I think part of that's also in
Exactly.
the black and brown cultures. Like we do not like seeing doctors of
Because
any
it's
kind.
Jesus.
General.
Because
the Lord will save you.
Jesus,
Jesus
or
or
just a
holistic.
culture where you're like you want to be like Zen. We don't need
Yes.
that. We could just do some plant. And there's nothing wrong with the plants because I take all the.
There's
holistic
nothing
things.
wrong with the plants.
we love the plants.
Well,
Yeah.
I don't
But what
want
I'm
to
saying
hear
is-
anymore. Because with my son, I hear it all the time. He just needs to identify more with Christ.
Get out of
Really?
there.
Was Christ in the
Oh,
medication that he
goodness.
was taking?
What is it?
God,
You,
'cause he
you
was-
can
he was
love
balanced.
God and be on medication. You can love God and be
And
in
Jesus
therapy.
is
You
in
can
everything.
love God and see a medical doctor. So my thing is that there's for me synonymous. But I think what I love about this panel right now is that we have a bunch of black and brown people sitting at the table talking about mental health, depression, postpartum depression.
Are we black and brown, or are we all just
Are
brown?
we
That's
black and brown?
politically correct. So, when is mental illness? When would you say mental illness is too severe to treat
I think she's black and brown.
without
She's
medication?
mixed.
Without medic. Okay.
I mean, she's half black and brown.
We talk about ethnic breakdowns
Right,
over
after
here.
her.
We talk about
Y'all making it so
ethnicity.
impossible
I'm
to
being
stay
very
on time.
awoke.
cultural identity.
But go ahead, Allison.
So I think that's something specifically for your doctor to figure out with you, right? For your
Right.
team, like specifically.
Yes.
But there's different levels of severity. They normally just break it down by like mild, moderate, and severe. So like you can come in with major depressive disorder or postpartum disorder with severe symptoms, mild symptoms, or like moderate symptoms, right? So once we're hitting the moderate and we've left the severe and your functioning is being impacted, where now you're not going to the games, you're not going to work, you're not able to go grocery shopping, you're not showering, you're not brushing your teeth, you're
The
not doing
sexual
your hair,
libido's off.
you're not taking care of
Random
where your functioning is
Sexual
starting to
libido.
decrease. That's when I think it's time to connect with your team. Let your team know these are the symptoms I'm experiencing. I'm not functioning in my life the way I want. What are my treatment options? So the term is treatment options. Like, what do you recommend for a treatment?
So, what are some of the signs that medication is absolutely necessary?
I think once again, I want to go
There's
back to what Allison
psychosis and
said.
there's neurosis.
I think, yeah, but I think it really it's very tricky. I just think people, if you feel something, say something and go to that doctor of yours and that psychiatrist. 'Cause I think that's really, really important. Because then somebody might listen to us today and say, well, that's not happening to me or this is happening to me. And I just want to be very sensitive to the fact that somebody might take what we're saying the wrong way.
It's a spectrum.
Because there's a wide spectrum.
So
And
you have
depending
to
on
be
your
open.
genetic makeup,
Yes.
it is really, it's really gray.
Well, I mean, I'm asking because I didn't have suicidal thoughts. I didn't have thoughts of harming my child, but I didn't want to shower. I didn't want to brush my teeth.
Self
I have
care.
a
I
Self-care is off, yeah.
did not have a sex drive at all. I laid in the dark. I don't want to talk on the phone. I don't even want to text back because I don't even want
You're
I don't
isolating,
even want to engage.
withdrawing.
And so at that point, my therapist is like, you should probably go back on medication.
Mm-hmm.
But I also am aware of all of the factors at the time. There was Love and Hip Hop. There's a breakup. I'm beefing with everyone. And some of it is because of me. A lot of it isn't because of me. I'm forced to go to this job where I'm going to have to beef where an insecure ex-girlfriend gets the bug and then puts it in this one and then puts it in. And then next thing you know, I'm in this crumble. There's several things going on.
Well, I can at least speak to that. When I refused to go back season 3, and I was signed to do season 3, and I remember there was family issues or whatever, and when I literally said I'm done, and I called my attorney, he said, right now, because you haven't filmed one thing, get out. And when I did, the relief, and I didn't think about the money I was losing. I thought about nothing. I literally felt like a freedom I can't even explain.
So you
like
made the
don't
right
have-
decision.
Yeah.
I did. It's a scary thing because I made great money.
Right.
So at
it's
some
like,
point
oh,
you gotta
shit.
protect your
Okay.
health, right?
Well, yeah. So it was
Just
my
like, enough's
sanity,
enough.
or that's how I felt. I felt like I
Yeah.
just can't do this anymore. So as that pertains to what the actual subject matter is,
Yeah.
it was then that my doctor was like, well, if you're gonna get through it, and I think for me the defining moment was the Princess Love chair thing, because at this point my mom had been public with my brother's diagnosis and what the family was going through, and I just knew that that was going to be the first thing she said to me. And then that compounded with at that time, she had never apologized or owned up to or admitted to the fact that season 2,
So what happened?
our beef didn't start because of my association and budding friendship with Tierra. She verbally accosted me before anything happened.
So
And
that
it was
was like a
it was
breaking point.
that happened, and then our beef just snowballed from there. And then boom, I'm like, this is gonna be the first thing she throws at me, and sure enough, she did. And so when I lost all regard for an unborn life that I now look at and go, I don't even know how. Melody is
You got
so
that space.
gorgeous.
Yeah.
Princess is a great mom. She and I have come a very long way. The world saw us make amends on the reunion stage. What was that, season 5?
Wow.
Hug it out. And then I never,
That
you know,
had to be good.
the since then the communication has been very genuine. We don't, you know, unless we're asked or in a scenario like this, we don't say like, oh yeah, we chit chat, you know what I mean? But we check on each other. Point is, that was for me when I was like, okay, now they said I might want to go back on medication. I'm running around here trying to beat up pregnant people. I might want to, you know,
Get that under control.
get that under control, because when you talk about genetic predisposition,
Right.
there are killers on my biological father's side of the family. So when I'm saying to people, and that's
due to
not
mental illness.
right, and that's not that's not like you know, this is a real thing. That's not an exaggeration. That's not like me. That's real life.
Yeah.
And so now I
To be
know
able to
that
see. So
I
the
have
gift
the
is that you can see
propensity
that, right?
to
That's the
get
gift.
there.
Yeah.
So when I'm telling people, you might wanna. If I have something to say about everything all the time, as we see. So I used to tell producers, when I run out of words, we're running into problems, because now I only have that one, and I actually got really good at like tuning people out. So I'm not hearing anything you're saying. I'm really just like scoping around, like, how can I get away with
They
this?
call
How
that the
far
tunnel. They
can
call
I
that
go?
the tunnel.
I have,
Right,
I
she's
have,
tunnel
a,
vision
I have
on
a
that.
question on this very topic for Allison and Aaron. And my question is simply this, and I threw it out here, and Aaron, you kind of just gave me one of this.
I get that a lot.
Neurosis and psychosis. So here's what we were talking about: how to take meds, or should you take meds? From what I've understood with my experience in travels and mental illness, neurosis is something that can be treated. It's a behavioral adjustment. A psychosis, which again, a psychologist, a psychosis is generally
A
something
psychologist.
a psychologist would be able to deal with a behavioral
uh-huh.
issue. They can't do meds.
Right.
Where a psychosis, something that's on the psychological realm, that there may be chemical differences or bipolar mania or things, and that's, you're seeing a psychiatrist because a psychiatrist gives meds. So I'm making a statement but asking the question.
We already covered it.
So
In other words, would that be okay?
I get what you're saying though.
and what I think is that one of the first things I do with my when I was in treatment, like as a therapist, one of the first things I would do with clients was autogenic training, where you connect a little like a thermometer to their finger and you connect it to your computer, and we would do this like hypnosis where I would repeat, like, you know, my hands are heavy, my hands are warm, my hands
Hypnotize
are heavy,
me.
my hands are warm. We ain't doing this. I'm gonna have everybody over here. No.
Show me what you got, girl.
So what you do, and then as you're saying it over and over again, you begin to, they watch the temperature of their hands go up.
Is that a diamond in your tooth?
Oh my God, we are
watch,
on a time.
we are literally
like,
all
let
over
it
the
go.
place. So you watch the hand temperature go up
I got mesmerized.
because you can change your biochemistry through thoughts to an extent. The more you think particular thoughts, the more you connect those wires, the more that those connections are connected, the easier, like basically your mind is like a super highway. It starts like a little beaten path, like a little tiny path that you have to like cut the brush from, and then the more you think a thought, the bigger and the bigger and the bigger, and eventually you have a freaking 5-lane highway going both directions. So if you can create thoughts that shift and change your biochemistry, you can also create other thoughts that will shift it in a different way. So there is work that you can actually do to change things like hippocampal density. In depression, people have less dense hippocampuses, which impacts the way that they remember things. They tend to remember negative things more than positive things. You can change that through talk therapy, right? There's been MRI studies that have shown that. And that's why it's about your team and it's about you specifically, right? And so your team can tell you, like, okay, this is what we recommend. You know, the psychiatrist thinks you should take this med. Because sometimes psychiatrists will be like, you know, I think you could do it in a different way. But
Yeah.
it's really up to your team. It's just so
So
hard.
that takes
Yeah.
me to takes us to the next part of this, and how young is too young to diagnose children with mental illnesses or disorders. You know, you hear every parent is like, oh, he has ADD. But it's like, does he have ADD, or is he just being
Is
an
that his
undisciplined
nature?
3-year-old? Like,
Right.
is he inherently just a live wire, or
It depends on the
are
diagnosis.
you not like active, and he's just being a toddler?
I'm
My
with
son
Monique.
was
There's no one
diagnosed.
size fits all.
And I said I'm not medicating him. And yeah, it's moments where he's just off the chart, but I've learned how to control it after 12 years. I keep
So what
him in
does off
sports.
the chart mean? Like
Off the chart
like with
is-
energy?
Energy off, energy. Like he would not sit down. It's been too many, and I'll go and I'll have a talk with each teacher at the beginning of the school year and let them know. And you know, if he has any issues, just call me directly. And a lot of them would be like, he just doesn't sit down.
They overpathologize
He's
our
in
black
class
boys.
and he'll stand up the whole time.
Okay,
They
I
overpathologize
have to
our
stop
boys
right here
sometimes.
because this is all for me. Everything I share is always about my experience.
Go.
My son was diagnosed, and my husband had that exact same conversation, and it's one of the things that we regret.
He did not want to medicate
He
him?
did not. We did not medicate him, and you know, and I don't know what came first, the chicken or the egg. But what I do know is that I believe, and David as well. I'm going to speak for him. We should have been more proactive in the more extreme, not diagnosis, but the more the whatever was prescribed. We should have gone to that.
Yeah.
We really should have explored
And-
what was being suggested by multiple doctors, but instead it was, you know, Dave's like, I have a black son, and they're just trying to blah 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 blah, and I'm like, now our black son, we all see where we are.
And I agree with your perspective too, is that you need to have your team, listen to your team, trust your team. You can get second opinions, third opinions, fourth opinions. But as the evidence starts to come in, because there
Yes.
is an interbalance of, you do have black kids that get, you know, diagnosed with more severe diagnoses. Is it because naturally black people have higher, more diagnoses? Not necessarily. Is that
We're two
but-
times more affected, two
but-
times more likely to have to be affected by any type of a mental imbalance than white people.
And a part of it is also because of the
Statistically.
natural, it's also partly because of the experience that we've had. So when people have actually had like testing done on their community, right? Knowledge of the Tuskegee study impacts African Americans' interest in attending any medical visit. Just having a knowledge that it existed. So if you have a paranoia that's based in nothing, that's true paranoia. But if you have a paranoia that's based in
Right.
reality,
Or
it's
a trauma.
different. Or an actual trauma. So if you're actually being followed by people because you live in a neighborhood where maybe it's a little bit more dangerous and there's actually gunshots outside of your
Right.
house,
Right.
are you paranoid that you're scared about getting shot? Or are you just experiencing natural trauma from the environment that you found yourself
Right.
in? And so that's why ethnically considerate diagnostics are very important. And we don't have to do it. Where's she going? What have we done to this woman?
They got babies in the back.
Bring the baby. But
Yeah.
you know, and so I think we have to be
Don't come over
conscientious.
here, Marla.
But I think, but to your point, when I talk a lot about functioning, right? If your kids can't learn because their ADHD is so severe, I'm just gonna come over.
Yeah,
here.
my brother
Hug her
had,
I'm just gonna
back.
take over.
Hug her
he
back.
had 150
No, I'm
missing assignments.
I'm taking over the whole show. No.
He had 150 missing assignments in, what was that, like
See?
6th grade?
If if now your kids can't learn, medication
But
might help them
but
learn.
how did my parents miss
We
that?
didn't miss it.
No. I want to be
I
very
didn't miss
careful with
Yeah,
the,
I'm
how
not-
do they miss that? Because I think every parent
didn't
does
miss
the
it.
best that they can.
We didn't miss
And
it.
they try to go based.
It got to
I was
150.
saying what had happened. What, Aaron? You better. Ooh.
So
I'm
what?
glad
That's what I'm
Tiffany
saying.
came
That's
back.
why I say there's a double
Oh,
side.
I'm holding
There's
back.
two
What I-
sides.
what- what-
The
no.
child has the
But I
learning,
think
the inability
I have
because of
clients
the
right now
ADD.
that are quote unquote missing 150 assignments, and what happens is some of those kids are on medications,
But-
and so I think it's a very tricky
Unique.
situation, a
It's
slippery slope. Because I think in my experience,
But the
most
child brings
parents-
home the assignment. Do they know?
No, she didn't. No, he was signing. Where's his parents? So basically, he was forging the signature. We would have to come right. So we didn't know. He was
crafty.
forging
He was
our
crafty.
signature.
Crafty.
Like daily.
He would have to sign
assignments.
exactly. He'd have to sign it and take it into Mr. Capretta, and he was forging our signature. So that's why it took us so long to catch up to it. In
But-
that one system, I'm just saying. That's
But at the same time, does he not bring you are so we were
Be
so
that
there
progress
and
reports,
We are.
right. So what I'm saying is a child has to bring home forged signature or not.
He wasn't.
I have to
he
bring
wasn't
home my
bringing home.
assignment.
He wasn't. He was bringing home saying that there was no homework. How many times has
Can I
that
just
happened?
also say that times have changed? Because I remember like my class
Everything's
now.
digital now.
Everything is digital now. But back then, when I
Portals
was younger
exist
or my
now.
siblings were younger, it was paper, and my
Yeah.
parents didn't really always know unless they went to a PTA
Correct.
meeting.
Well, here's another
and
thing.
if you're working a lot, you don't make it to every PTA meeting, so you think. You
And
don't
that's
really
how we-
find out
that's
until
how
like a
we caught it.
midterm or to like an intern report
And it might be
card.
too
so it's
late.
very easy back then.
Monique.
But I think
But it's a team. It's what I think. If we can take anything away from
Let's go
this,
back.
it is about a team because everyone's mental health is unique to them and their
Yeah.
circumstances and their culture. Because we could all be from a similar ethnic group, religion, socioeconomic status, but our houses are going to be different culturally a little
facts.
bit based on whatever uniqueness is in our family. And so having your specific team that's aware of your family culture. You know, because like me, I have two little sisters. There's three of us, and we all are still different. We were raised in the exact same
Y'all
house,
are so
the exact
different.
same parents. We are entirely different. We were raised in the exact same place.
Yeah.
And Monique, we
So-
have that same scenario. The dynamics between you and
Well,
your
I also
sister and
have
your
a
brother.
different father. So let's just put that
But
out
even
there.
with the same
But you
parents,
were
people can be
raised
so
by
different.
the same
But I
two
still have a
parents. That's true.
completely different
Fair.
biological
Genetic
and
screen.
genetic makeup.
I just want to say, like, going back to Allison, just to wrap it up.
Sorry.
How young is too young? It depends on the diagnosis. Like, we don't diagnose, well, I don't do this anymore, but at the time, I wouldn't diagnose somebody with certain diagnoses because they were too young, like schizophrenia. Like, you want to wait till, like, a little bit older, but, like, ADHD, they might do that a little bit younger. But I would say going back...
Like 5.
Right, I think...
Usually it's
or
18.
ADD.
I've
It's
seen
been
some
18
people
is-
who
is
have been
what I've-
Yeah, go.
No. I was saying for my family, 18. was
I've
what-
seen.
And I mean, there's
I've
gray
seen some people
areas, too.
diagnosed with bipolar disorder at 6 months. I've had clients.
What?
Yes. Yes. Inappropriate, not effective, but it happens all the time, especially in the system. Kids who are in the system. I had a client when I was a social worker that was diagnosed with bipolar disorder at 6 months old, which not an appropriate age to do that.
The baby cry
But-
and
Yes, it was
and laugh in the same.
inappropriate. It was
Wow.
inappropriate.
How's that even possible?
I know.
Scary.
First of all,
And
kids
who would
cry and
accept
laugh all the
that?
time. Kids cry and laugh all the
It's a
time.
gray area, too.
But it's a gray. So officially, you cannot diagnose somebody with a personality disorder until they're 18 years old.
Boom.
So that is one, the official diagnostic.
Is depression
They-
a personality disorder?
No.
No, it's a
Okay.
So you
mood
can
disorder.
diagnose somebody with depression younger, but depression looks different in children than it does in adults. In
Yes.
children, they're more agitated and angry, and in adults, we're a little bit more tired and exhausted and withdrawn. Not all the time, right? You can have irritable depression as an adult, which makes you a little bit more irritable, but children tend to be a little bit more hyperactive with their depression. And so you can have anxiety in children, you can have depression in children, you can even have schizophrenia in children, but normally when it is very severe, you will see a diagnostic. When it's
So
just
isn't that called cognitive, social? So that those are like the kids that kill the cats and like
Well, that's
No,
that's
that's
out there.
conduct
That's a
disorder.
Conduct.
Conduct disorder.
conduct. Okay.
Later on, answer.
Intermittent explosive disorder emerges then
So
into conduct, which is then adult.
Before we
antisocial.
leave, because I really need a professional opinion. When Monique was born, all the way through her adolescence, she was
was
heterosexual, and then she became a lesbian. Is there a diagnosis for that?
No, not anymore.
No.
Was
Not
it
anymore.
someone
It's
turn
gone.
her out? Or
It's
was
gone.
it-
So, to close out this episode of What Had Happened, I'm telling you what had happened was we lost an icon, a living legend.
Yes, we did.
So, losing the game, this segment is one that Aaron in particular really wanted to touch on about grief and loss. So, in the wake of Kobe
just
and
shifted, okay.
Gigi's passing, which is I'm not even a sports fan, but my son plays at Mamba Academy and has encountered him and has all these like positive experiences, and that's like his favorite place to play ball
Yeah.
because there was just so many. Oh, this one came today, and I saw Kobe today, and
Yeah.
Kobe's daughters play there, and so there was just a completely different energy in that building versus when I go to these other games, and I'm like, oh.
Yeah.
This shit over, and like, you know. So, I don't know. I think that
Take care of yourself.
Well, we're just going to the grief part. I just
Yeah.
felt like what came up for me is that I just felt like so many people were grieving, including myself. And when I found out the news, it was Grammy weekend. As y'all know, the Grammys were happening. I had these parties to go to, and I love a good party. I love hanging out on the weekends after working so hard during the week. I go out during the week too. And I was like, yo, I can't go anywhere.
He's like, I go out every single day.
I would go every day,
Yeah,
but
party all
I
the
do,
time.
you know, LA has parties all the time.
That's
But
true.
I remember thinking, I'm so excited to go to Brunch to Bomb. I'm about to go to this party, this industry party. I was about to be in like the
Wow.
cool places, and I was like,
We're
I
not cool. We're
can't
not
go.
cool. We're not cool.
no,
Just
we
don't
can
go.
come. Like,
So,
let's
is-
get back to track. I just want to say that I in that moment I felt so stuck, and I was like, oh, I need to eat. oh, I didn't. And I was like, I didn't even know Kobe. But
Right, I think
but it
it's so-
affected me in
right.
such a way that I was like, because it's like, you're not supposed to die at 41, and the way in which you died,
Right.
with your daughter in your arms and your friends on the plane, you think, oh, I'm gonna, it was supposed to say we take leaving the house for granted sometimes and coming back home safely. And so for me, it was just like, I just know so many people were crying, people were like grieving in so many different ways as if they lost their immediate
Brother,
family
uncle,
member,
right.
you know what I
They
mean?
were
And so I just felt like in that
identification.
moment it was important, like dealing with depression
We
and
can't
grief, they all tie
neglect.
together.
Yeah, and we can't neglect secondary trauma. Okay?
No.
So we tend to believe that trauma is just something that we've experienced. So we've been in an accident, someone we cared about died. You can experience trauma from hearing somebody else's story.
Mm-hmm.
Especially if you identify with it and you empathize with it. I mean, I at first was like trying not to engage too deeply in it, and then for the past 3 nights I've been having Kobe nightmares. You know what I'm saying? And like legit, like worrisome, like I'm so like stressed about it because I think I kind of pushed it away and was like, I'm good, I'm good, I'm good, I'm good. So it snuck out in my dreams a little bit, and it's just real. And if you're going through it, that's okay.
It's okay, and there's no
I
wrong
Take
was
way
care
to
of
do
it.
it. I was just saying
on a
this.
friend and I felt like my brother died.
Right.
Right.
Wow.
We were in church and my little brother, who's a huge Kobe fan, tapped me like and showed me the phone, and I turned around and I was like, "That's fake."
Mm-hmm.
And he was like, and ESPN's like alerting, and I'm just like,
I didn't believe it either.
and I was totally
I didn't
just,
either.
I was done.
Right.
I was done. I got in the car, I cried,
Ooh.
and I'm just like, being in the arena and
So
And
is there?
one thing right quick, just to say this might help, it helped me,
Mm-hmm.
is to
We're
think
not gonna make 2 minutes, but go ahead.
impact. Just what is left. What's
Yeah.
left? What people leave with you. The Kobe left such a positive. So to me, I have to ask myself, I'm alive.
Right.
So how can I honor him?
And my goal, my thought is there's no wrong way to grieve. I think that some of this actually goes into postpartum and as well as just general depression. I mean, journaling, listening to music, doing things that like honoring your feelings. Don't try to push them away. Like lean into them. Talk to people about your feelings, and it's okay to grieve for a celebrity or anyone that impacted your life. Obviously a family member, a friend, or something like that too. But I just think it's really important to acknowledge those pains. Like Allison said, she pushed it away, and then all of a sudden she's having Kobe nightmares, and there's nothing wrong with that either. I think sometimes people feel like it's wrong to grieve or weird or what have you, but I think it's okay to like acknowledge those feelings and to like go through the motions. You know what I mean? Listening to music,
So
watching funny
we
shows.
saw an interview of one of the husbands of, I forget which wife that was on the chopper, and he said that, I think the person who was interviewing him said, how did you break the news to your children? And he said, I have like a 11, 9, and 3 or something like that. And he said they screamed, they cried, they said no, and I just hugged them and let them scream. I had to let them cry. I had to. So, is there any? I would venture to say there's no right way, like to talk to children about death and loss. Like, and it reminded me of. I was talking to my grandpa the other day, who was my mom's dad, who was just knocking on death's door, literally, and I said, you know, it's very interesting because Cameron remembers my Aunt Cora. And that is my grandfather's sister.
Mm.
And she passed away when was that my door?
No, it's me hitting the table. Sorry.
She passed away when Cameron was about 4. And so I remember we were going to go to the funeral, and I was like, well, we should leave him with Drew because, you know, it's open casket, and I don't want to. So my grandmother, my mother's mother, who's a, let me not say doctor, psychiatric nurse and RN, she
What happened when she
told me, basically, you know, this is how we'll do it. And we'll talk to him. And if he says he wants to go, he goes. And we don't sit him close unless he says he wants to.
Yeah.
There was like a whole family plan around taking Cameron to this funeral. And she said, so we talked to him about death and whatever it was, family discussion, and he was so nonchalant, which to me just said he's not really fully processing this unless he sees this or whatever. And we get to the service, and I think my mom was carrying him, and the family, we were sitting up front, and so my mom just sat down. She didn't go to the casket right away. And he said, oh, that's on Cora.
I want to go see.
I want to go see.
I said, are you sure?
And so my mom said, okay. So we looked at Mimi. She was like, you know, take him up. And so she took him up, and He stared at her, and he stared at my mom, and he looked back at me, and then he was looking in the casket, and my mom was like, "Are you done?" And he was like, "Yeah." And so I was telling my grandpa, he had very few interactions with her prior to that.
Right, that's true.
But it was very interesting that he was like, "That doesn't look like her." And so we were like, "Well," and
How
there was
do
a
you know what
picture
she
of the
looks like?
obituary, and he said, "That's her."
Yeah, like
She
I
doesn't
know,
look
I
the
know
same.
her.
You know, and so now the obituary is in his room, in the top drawer of his nightstand, because when I moved from that house to the apartment and the apartment into this house, he took it with him and he would tell people, "This is my Ancora, she died. She died when I was like 4. She's dead."
But you know, here's the
And
thing.
so-
Wow.
Like, I think sometimes
It's actually true.
we have to know our own kids, right? You know
Right.
your kids,
Yep.
but I think sometimes we shelter them so much. Kids back 200, 300 years ago were confronted with death a lot. But no, coping, I was just going to say something about coping and that we learn how to cope from our parents. So as parents, learning how you cope is important because your kids are watching,
Yes.
paying attention, they're passively learning
My
without...
dad just lectured me about this. He said Cameron is genetically predisposed to being, well, what he really said was,
You're gonna filter
what he
this?
really
no,
said.
what he really
Oh,
said
God.
was, Cameron likes to watch these YouTube videos, right? And now he's obsessed and he's trying to solicit anyone in the family to buy him a baby saltwater alligator. And so my dad says, they're
You
cute.
be wanting random things.
Yeah.
Even at
So
Christmas we did.
he did. So he said, he said the baby salty is cute, but that baby salty grows up to be a salty monster. And right now you have a baby salty, and so he's cute, and these little things that he does, and you think, oh. But soon, come here, that's
Yeah.
gonna be
And he's
a
18.
grown salty,
Mm-hmm.
and your genetic predisposition, murderers.
Jesus.
We have to basically look at how what he said is it's not what you say. He's watching what you do.
Absolutely.
So he's watching how you
Absolutely.
slip into these depressions and how you come out or don't come out.
And
Or
then-
how you lash out.
Because here's the
And there's
thing.
nurture
How I
versus
manage
nature,
time.
Because
right?
we
Yeah.
also tend to feel like we have to keep our kids from seeing things. And that's not always the truth. It's about helping them understand what happens when these things
Explaining,
happen.
how to
talking
process.
about
How to
it.
process.
How do you
You
deal with
brought
it?
you brought up a good point, Aaron. You told me that or was it you? Maybe it might have been both of you. Basically, the association when I mentioned his dad's name, maybe a smile,
Oh, yeah.
or
Yeah,
that was you, right?
Yeah.
Break that down one more time, because I thought that was really good.
In that moment, it felt good. 'Cause it was, I don't know. I'm
I
trying
know,
to think.
I
Pull it
know
back
what it
up.
is.
Oh, so basically, I just think when it comes to parenting.
Co-parenting, we were saying that
co-parenting.
he feels guilty. Like I can tell when he gets with dad,
Mhm.
he's he's more hesitant to answer my calls, be affectionate. But then when he comes over here, he's way more open. He's needier. He's softer.
But he's also protecting. I feel like from what you told me, he's protecting both of you. In this
Correct,
sense,
that's what I'm
right?
saying.
And so I think to that part,
So
I
I'll
think
say,
it's-
I'll pick him up. Call your dad. Why? Because he misses you, Cameron.
right. So
I'll
I think
call him when I'm done with Roblox. And then he'll sneak, like, we'll get home. And he'll be in his room.
he'll sneak
And
go
he'll
dad.
FaceTime dad,
And so I think the key is though, even like the energy that you're giving dad right now, it's not negative.
At
I think,
all.
But no, it's not, which is beautiful. But I think there have been moments in the past for most co-parents, including yourself, right, where the energy is
Guilty.
not always positive.
Sure.
And so I think it's like kids are very, very hypersensitive to everything that's going on around them, and they're sponges. Like they don't just pick up on things you say, but they pick up on body language, they pick up on facial expressions. And so if, like even in the way you say "baby daddy," it could be loving or it could be like that mother effer.
Right,
You know what
right,
I'm saying?
sarcastic.
So I think the key is just to be extremely mindful about like what you're giving off to any child. When you're speaking about a parent, a grandparent, or even a sibling, because they feel like they have to protect you now.
They're children,
So
and
they're
there's only
children,
so
and
much
they
they
shouldn't
can
have
control.
to do that, and they
That's
shouldn't have
it.
to be. I hate the word
There's
should,
only
but
so much
it
they
would
can
be nice
control.
if they didn't have to also worry about caring for mom and caring for dad in that sense.
Right,
So
just
it's
being
like,
cared for.
so they let them be careful because they're young. So my thought is like when you say his name, it's like, hey, your dad's coming, like, and have a smile. Not that you're being fake, but you're being mindful and you're being proactive.
Like me and you, sweetie, how I cared for you. So beautiful. Kisses.
Boom. So.
Because I'm to a point now where I'm like, he doesn't run shit over here. If you want to be on my Instagram Live, be on the Instagram Live. Your dad doesn't control this, and you're not going to be in trouble.
But
But
even,
see, it
so
took me a
even,
long
so
time
that,
to get
but
there.
that goes back to your tone.
The
So even
intensity
if
with which-
the intensity.
I was
'cause-
very yes.
But my
I
thing is,
was.
you can say the same thing with a different tone has a different effect. And a different
Let's
outcome.
role play.
Meet the ball
I'm Cameron.
within the
And who
force
am I?
that it comes.
You're me.
You're
I'm you,
her.
and what's
yeah.
the topic?
The topic is I came home from Dad
Okay.
and you were on Instagram Live
Mhm.
and I didn't want to be in it, but I usually ask you to go live
Okay.
so
I'm
I
very
can show
confused.
your
I just want to
followers.
too.
Okay,
Are you
I'm Cameron
Okay, and I'm you.
and you're me.
Boom.
You're always live.
Always.
True.
Mhm.
You're my sister's
And
favorite
now,
channel now. by
okay,
the
thank
way.
you. And now you are being more mindful, spending time with
I'm,
you.
as a mom, is being more mindful of spending
Spend
time with
me,
Cameron.
so you
outside
haven't
of
been.
this. Okay.
Okay.
Go, Cam.
You're Moniece.
I'm trying to be Moniece.
Okay.
Put your Moniece hat on. Put your Moniece hat. Get the
We
finger
already
wave. Get the
dressed you
finger
up.
wave.
Put it backwards
Okay.
with Moniece, because you know things be a little backwards.
All right. First, you have to ask me. I want you to end the live?
Hey Cameron, what's going on? Do you want me to end the live?
No, Mom, I don't. I want to show your followers this. What my dad said. I can't be on your live.
Oh my God. Sorry.
I'm
I'm really good at
I'm
role
really
playing.
afraid Moniece.
Well,
No, I
yeah.
hate role playing. This is too
I
hard.
love role playing, but not on camera. So anyway, the Lord just threw me off.
I'm not an actor.
But anyway, I'm not an actor. I'm a real person.
Okay, go.
Alright, so the gist of it is I would say Cameron, so your dad doesn't want you on it, and you know what I'll do? I understand you're conflicted. Let me talk to your dad about this a little bit more in the future, because I don't think it's wrong to be on here. Your dad might want to protect you from the people out there in the world. None of it's wrong, none of it's right.
How
Let
are
me
they gonna
talk-
hurt me? They're on the phone.
Yeah, you know what, Cameron? You gotta trust me on this one.
Cam, you being difficult.
Cause you're just so damn petty.
Oh,
That's what he said to me.
Okay.
Well, part of me not
I'm
being,
on my way to the
oh,
car
part
to
of
get my
me-
belt.
a
No!
part of mommy not being petty right now is that I actually want to talk to your dad so we can be wonderful co-parents for you to make sure that
He doesn't
you're
want to talk
happy.
to you.
That's fine, but I'm gonna figure it out. That's not your job to worry about. I got you because I'm gonna protect you. Your dad wants to protect you. We both love you.
I hate you.
Okay.
Come to meet
That was
you.
a bad role play.
Come to
But
meet you. You
the
don't need to
point
be-
is, I think
yeah.
it's united.
That's not a bad role play.
But I
That
would say
was
though,
many
you-
scenarios rolled into one
Right.
role play.
But I would say like y'all have
What
to
is
still
being
be
difficult?
united no matter
Yeah,
what.
like Cameron.
You guys gotta be united no matter what. You and dad.
That's not gonna
All right. Well, on that note,
55 hours later.
I think we had a great discussion.
I think so.
We
We
had
can
some
talk about some
curveballs.
I have one thing to
But-
say. One more thing.
No,
One more thing, 'cause
my
I'm
God.
I just
Aaron.
want every mom out there to like honestly just love yourself, be kind to yourself, because I think there's so much. I said this last time, but I feel like there's so much. Thank you. I feel like there's so much pressure to be a
There's
mom.
something that I have to say on that.
Oh yeah.
Oh,
she's
she's back.
back.
She's back.
This
Look at
really bothers me. When I go on your Instagram or I'll go on social media, which is the damn devil, and they are beating her up and dragging her like, oh, I thought you're depressed. Why are you out? Why are you doing this? Do you guys not fucking realize that we have to still provide a roof over our kids? We have to provide food on this table, and that's what the fuck those hostings get her.
She said
We
fuck
don't like
twice.
the club. We don't feel
I
like
hate the
going
club.
there. That pays the bills sometimes. So
Amen.
get the fuck off her back with that shit. It's annoying.
When?
I'm done.
Sometimes
No,
you-
it
So-
really,
sometimes
it
my
really makes
children
my skin boil. Because it's
have
like,
feelings.
we could be on a breaking. We could be breaking, but we still got to keep the shit going for our kids.
It's
If
true.
we don't do it, who the fuck's going to do it?
Jesus.
But
I
you
can
can't.
call my mom and be
You
like,
can
Mom,
rain a
please
money
help.
shower, sis. We
But I
praying
mean-
for it.
Yeah.
I want to be a
But,
part of
but
this.
man.
can I say
You wanna
this
be a part
too?
of it?
Even
Come
to
on,
answer
come
that
here.
for Tiffany, you only you know what you can bear, but the internet is a choice.
And it's the devil.
And so-
Allison, where can they find you?
You can find me at AllisonHicks.com or Allison Hicks on IG. ALLYCINHICS.
And that's on Twitter too. I found you on
Twitter, yes, I'm on all the things, Allison Hicks. My name's impossible to spell, so I was like, whatever.
Everywhere.
she's on all the
ALLYCIN.
things.
All the things.
And Marla Talks. Tell them where they can find you.
Marla Talks, you can find me at Marla Talks on all platforms. However, I want you guys to also know that mental health is really, really important to me and my family. So we have a foundation,
LovingBeyondReason.com. Aaron,
So
Tiff, get in here.
Yep, Tiff. My name is Aaron, and my Instagram is TrendyNerd23.
23.
I just want to be different.
He's
to
on
be
Twitter
okay.
at the same.
I don't really use Twitter, but just follow me on Instagram
Twitter's
at the moment.
good.
Twitter is good.
I know it's great. I got too much going on,
Donald
guys.
Trump took over Twitter. Let's all go to Insta.
Black Twitter's bomb though.
Black Twitter
Black
is
Twitter?
good. It is.
Well, it's
a
a
hashtag.
it's yeah.
Wait,
Yeah,
wait a
she
minute.
is. I'm Tiffany Campbell _.
Daddy kept hacking it on.
We don't know
Tiffany
him.
Campbell.
I am Tiffany Campbell or the real?
I am Tiffany Campbell.
Okay.
I am Tiffany Campbell.
Underscore. You can find me on Instagram, Moniece_Slaughter, Twitter at Callie's World, Kalis. I'm not able to change it or I lose my verified badge. Sean, we can't have that because we
No.
need the coin pitches.
Yeah.
And I just want to say Happy Valentine's Day almost. So here's a little something
Oh,
for
Aaron,
you.
I feel so
Here's
thought
something
of.
for you. Shout out to all the
God.
mamas.
Oh,
And Allison, I got chocolate for you, but I was like, she's vegan, so.
Thank you, Aaron.
Happy Valentine's Day.
Happy Valentine's Day.
Hey.
Happy Valentine's Day to
Shout out to all the mamas.
all the
I'm your mother.
Baby Maya is running to the home. She's going to the home.
No.
And stay tuned. We have another episode. What episode is this, guys? 3? Episode 4 next week with McKinley Ave and his.